We will now demonstrate the application of a thoracic pedicle screw. Once the spine has been stripped subperiosteally down the spinous process lamina out to the tips of the transverse process, the anatomic landmarks can be exposed in detail, noting the full length of the transverse process as well as the superior and inferior articular processes of the facet joint, noting the lateral border of the pars at each level, and then providing visualization of both the transverse process and the ridge, as well as the lateral and then the medial borders of the facet joint. It may be necessary to do a partial or complete facetectomy, removing the inferior articular process from the level above to provide adequate exposure of the medial and lateral borders of the facet joint, as well as providing opportunity for fusion at the facet joint. Then the intersection of the transverse process and superior articular process of the facet joint can be decorticated for an entry point into the pedicle off of the superior ridge of the transverse process. The gear shift pedicle finder can be inserted into the decorticated region with the spoon facing laterally, and then is twisted while gentle downward pressure is applied in the trajectory of the pedicle. Once the pedicle finder has been inserted to 20 millimeters, the ball tip feeler can be used to ensure that there were no cortical breaches of the pedicle. Then the gear shift pedicle finder is reinserted, the spoon is turned medially, and it is continued in its advancement through the remainder of the pedicle and into the vertebral body, approximately 35 millimeters. The ball tip feeler is then used to sound the pedicle, once again ensuring that the medial, lateral, cranial, and caudal walls are intact. And then a depth can be measured for accurate screw length. The pedicle hole is then tapped and sound, once again ensuring the medial, lateral, cranial, and caudal borders are intact, as well as the floor of the vertebrae. The screw is then applied through the previously tapped hole. Of note, it may be necessary to remove portions of the transverse process in order to allow the polyaxial head to move freely. And that is the application of a thoracic pedicle screw.